Good evening, everybody. My name is Ahmed Magan. I'm a trauma and orthopedic consultant who specializes in hip and knee surgery. I'll be giving you a talk tonight on sports and exercise after hip arthroplasty. I'll give a brief overview, give you an introduction about hip replacements, trends in arthroplasty. I'll touch briefly on the surgical approach and also the types of sports and exercise patients do, evidence behind sports and arthroplasty, as well as what patients engage following the joint arthroplasty, and also what does the literature recommend that we tell our patients. And finally, I'll talk about recent developments. Hip arthroplasty has been described as the operation of the last century and is a very successful procedure with a high satisfaction rate for patients following surgery. Patients are living longer and they want to maintain an active life later on in life, and they want to have a good operation, and they want to be able to return to the normal activities as much as possible. Return to sports after hip arthroplasty is an area which has limited evidence-based guidance, although in recent years the research interest in this field is growing. Trends in arthroplasty, if you look at it year on year, the number of hip arthroplasty that's occurring in the United Kingdom and worldwide is increasing year on year. The preceding year, there have been more than 105,000 cases done in the UK, of which around 60% were females and 40% were males. The average age of females was around 70 years of age, while males were 2 years younger, at 68 years of age. One asks, how fit are these patients that are being operated on with regards to hip arthroplasty? And on the data that's recorded in the national database, it says 9% are considered fit, 70% have mild disease and not incapacitating, which means 79% of these patients potentially will continue to remain active and would like to potentially go back to sports and do exercise. The average BMI nationally is around 28. One common question patients ask to clinicians is, how long will my hip replacement last? And at 10 years, 97% of those joints are still functional. And at 15 years, that's more than 94% are still surviving the joints. And more than 25 years, 58% of those joint replacements that have been done are still functional, which is quite impressive. And if you look at this graph on this side, globally and in the UK, more females are having more arthroplasty compared to males. The females are the blue color and the male are the darker gray color, which is reflective that females tend to live longer, and arthritis is predominantly a disease that comes with age. So another question patients often ask is, I would like to go back to return to sports, but what's the best approach? What does the evidence say? Anterolateral approach, posterior approach, direct anterior approach, minimally invasive, or other approaches? When you look at the literature closely with regards to people return to pre-arthritic activity levels or return to sports, what approach is used does not make significant difference, and the evidence doesn't support one over the other, although some might allow patients to go home a few hours earlier or a day earlier, but generally across sport, it doesn't affect when they return to sports. Also, majority of surgeons do not change their approach to that patient's joint replacement just because the patient would like to go back to sports. They stick to the same surgical approach that they use. In literature and in practice, sports and exercise is classified into either high impact level, moderate impact, or low impact. So if the patients undergo surgery, the activities they engage for the purpose of simplifying it is classified into these three. So low impact activity is considered things like swimming, walking, cycling, dancing. And as you can see these photos, there's a patient who is 2 weeks post joint arthroplasty in the hip. showing doing hydrotherapy and doing exercise in water. Moderate impact sporting activities are such as playing double tennis, skiing downhill, weightlifting, and high impact sporting activities is considered running, jogging, playing football, squash, and playing rugby. As you can see, this photo was taken during the ISEH run a couple of years ago. So we touched upon the type of activities and how they're classified, but what does it say in the literature about when patients are able to go back to playing sports? The senior author in this paper was Professor Haddad, and we published a meta-analysis look at the time for return to sports following hip arthroplasty. And this has been published in Hip International last year. And the results from this meta-analysis, there were 11 studies with 2,297 patients. And after hip replacements, 76% of the patients returned to their activity levels in terms of doing sports 4 to 6 months following surgery. And at 6 to 12 months, 93% of those patients were engaged in sports. The overall return to sports rate at the final follow-up in these studies was 84%. What about hip resurfacing? Well, again, there was another meta-analysis that we published from our unit, look at when patients go back to exercise and sports following the hip resurfacing. Similar to the previous meta-analysis, there were 11 studies. In this study, there were 659 patients, and the return to sports rate at 3 months after hip resurfacing was 91%. At 6 months, it was 96.8%. And at 12 months, it was around 82%. And at final follow-up for these 11 studies, 90% were still doing sports following surgery. What sports do patients return to following the surgery? Well, to answer that question is a multifactorial in what sports patients return to. Often this is governed by what pre-op activity levels they were at, what type of sports they were playing, any medical problems that they had, their age, and also the patient's perception. Generally, most patients can do low-impact sports following hip arthroplasty. Some patients who are doing high-impact sports might switch down one level below and they start doing moderate impact sports, but the vast majority can do low-impact sports. And you can see there's a number of papers that have been published regarding this topic. So in summary, the advice that you got to know what the patient's expectations are and their ability to do sports. There must be an informed discussion between the patients and those all involved in the patient's care, from referral to rehabilitation. This is a multidisciplinary approach. The predictors of returning to the same sport are the age of the patient, the physical fitness and the health of the patient, their pre-op activity levels, and also the surgeon's advice to the patient and the patient-reported outcomes. It's been widely accepted in literature and the published papers regarding sports that, for example, a UCLA score of more than 6 is a predictor of patients returning to their activity levels pre-surgery. Another myth that patients often ask about is, if I do sports following my surgery, I'm worried about the implants failing early. I'm worried about the implants wearing out. It might give me additional pain. It might give me a poor function of the implants. And also another big factor they get concerned about is the risk of subsequent surgery, like revision surgery. But from having read the literature and published numerous papers, the surgeon's advice plays a crucial role in giving the confidence in patients to engage with sports. So if the surgeon at consultation or the clinician that they see or anyone part of the MDT that they see in this patient's journey encourage them to get back to activities, then the patient has more confidence in the outcome of the surgery and being able to engage with sports. Just to finish off, in the last decade, there's been recent developments with regards to navigations and robotic surgery. Now we can do personalized hip arthroplasty with technology. the published evidence from globally, it's being shown that robotic surgery reduces inflammatory response. This was a study that was published from University College London, led by Prof. Haddad. It's been shown we reduce the length of stay. There's less soft tissue trauma. And more importantly, it restores the natural anatomy with precision and reproducibility. Also, if you go one step further, using Navigate or robotic surgery combined with day case arthroplasty, patients would perceive hip arthroplasty as a normal procedure, as a day case. Again, it will increase their confidence to be able to go back to activities because they've been able to go home quicker, they've been able to walk. And this is a paper that we published, look at the pathway we established at the University College London Hospital about day case hip arthroplasty. So things are changing. Patients want to continue with their sports and activities, and we've got a crucial role to play from the minute a patient gets referred to the secondary centers, and also from the physiotherapy perspective as well.